to all the viewers. Myself, Dr. Rajesh Singh, Associate Professor at Parul Institute of Law, Parul Institute. Today's topic of the webinar is medical negligence and its development. So we have total 4 speakers today, and out of one, Sir S.S. Naganand sir is the Senior Advocate, Supreme Court of India. So let me introduce about all the speakers, and then we will start our session. So first of all, S.S. Naganand sir, who is a senior advocate, Supreme Court of India, with 40 years of experience. S.S. Naganand sir is one of the most well-known senior counsel in Karnataka, and he has represented some of the biggest corporate names in the country. Mr. Naganand started practice in 1981, and he has also been the president of Rotary Club, Bangalore, and is trustee of Sri Satya Sai Medical and Media Foundation, as well as Lahari Associates Foundation. Mr. Naganand concentrates his practice on the corporate and commercial laws, international trade and business law, taxation law, intellectual property, infrastructure, power and electricity laws, venture capital investment, arbitration and mediation, and the land laws. His commitment to the society is alive, and his love of the law demonstrated by the strong pro bono practice, and currently he is the senior designated advocate at Supreme Court of India. So, sir is joining 10 minutes later on because his matter is going on right now in the High Court. Coming to the second speaker, Mr. Viswajit Chaudhary, who is the advocate at Supreme Court of India. Viswajit Chaudhary, sir, is graduated in the law from the University of the Kent, Canterbury in 2011 and was called in the bar in 2012. He went to complete his master degree from the University of Cambridge in 2013. During his time there, he pursued the criminal justice, philosophy of criminal law, history of the civil and criminal laws, and jurisprudence. Aside from his legal career, he is interested in the human rights and their protection, poverty, elevation, and social service. Furthermore, he has also contributed in economical empowerment, and Viswajit sir is now a trained barrister at the law and advocate in Delhi. Furthermore, I just warm welcome you, sir. Next speaker is Dr. Malika Gautam. Dr. Malika Gautam, who is an advocate at the Supreme Court of India. She is the recipient of Nari Ratna Award and is the gold medalist and PhD. She is a practicing advocate in the Supreme Court of India and International Court of Justice, the Hague. She is an academician dealing with the various topics of the law, and she is also visiting assistant professor in Manav Rashtra International University and K.R. Mangalam University, Delhi, NCR. She has conducted different kind of the cases before the trial court, high courts, that is Delhi and outside, and Supreme Court of India, and conducted various national and international arbitration matter and other alternate dispute resolution matter, and she is a good understanding of the law and drafting with good authorship skills. She works in various sectors for the women empowerment and the women's right awareness. She has worked as a mediator in solving the family dispute and solved various matrimonial dispute through the mediation. She is the head of the women's cell of UVA, an NGO which works for the furtherance of the common right and education of unprivileged children, and an ally of the LGBTO plus community. Furthermore, we have another speaker, Dr. Prashant Pratap, Advocate, Supreme Court of India. Dr. Prashant Pratap is a partner with Pratap and Company, a litigating AOR laws firm. He is a bachelor degree in dental surgery and other in the law also. He has enrolled with the Bar Council of India, and he work experience include handling matter concerning the civil, criminal litigation and arbitration. So on this note, I warm welcome you, all of you. And today we have right now Ruchi Tiwari madam. So I request Ruchi Tiwari madam to warm welcome our all the speakers. Ruchi Tiwari madam. Just a minute. Yes. Yes, madam, over to you.
Thank you so much, sir.
Yes, madam, we have total 4 speakers, and senior advocate S.S. Naganand sir is joining late. So, ma'am, please acknowledge and warm welcome all the speakers. Over to you, ma'am.
Thank you so much, Rajesh, sir. Just a second.
Yes, madam. Yes, madam. Please. Yes, madam. 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 Yes, Yes,
Uh, yes,
we
thank
should.
you, Rajesh sir. I welcome all the panelists and the faculty members and the students. And now I would like to ask sir to start the panel discussion. Thank you, Rajesh sir.
So today we will start with first of all Malika Gautam madam, because she is the senior also. So sir will going to join later on. So now the session is handing over to Malika Gautam ma'am. Over to you, ma'am. Hello, I'm audible, ma'am. Hello.
Am I audible?
Yes, yes, yes.
Yes, all right. First of all, a very warm thank you to Dr. Rajesh for organizing this and introducing all of us. And good afternoon, everyone. It is an honor to be amongst such dignitaries such as Mr. Naganand, Senior Advocate, Mr. Vishwajit Chaudhary, who is an advocate, Supreme Court, and who happens to be a very dear friend, and Mr. Prashant Pratap. Without further ado, let us first start with what the topic actually means. Now, medical negligence can be defined as the proper, improper, or unskilled treatment of a patient by a medical professional. This could include anybody, which could be a physician, a surgeon, a pharmacist, or any other person who falls under the category of a medical practitioner. Medical negligence occurs when a medical or healthcare professional deviates from the care of standards of their profession and causes injury to a patient. Medical malpractice is a legal cause of action that occurs when a medical or healthcare professional, through a negligent act or omission, deviates from the standards in their profession, thereby causing injury to the patient. The negligence may or might arise from the errors in diagnosis, treatment, aftercare, or health management. An act of the medical malpractice usually has three characteristics. Firstly, it may be proven that the treatment has not been consistent with the standard of care, which is the standard of care or treatment which is accepted and recognized by the profession. Secondly, it must be proven that the patient has suffered some kind of injury due to this negligence. In other words, an injury without negligence or an act of negligence without causing an injury cannot be considered malpractice. And finally, it must be proven that an injury resulted in significant damages such as disability, unusual pain, suffering or hardship, loss of income, or significant medical bills. Malpractice liability is normally based on the tort of negligence, and a broad general rule of liability follows when a healthcare practitioner does not show fair, reasonable, and competent degree of skill when providing medical care to a patient. Now, if a practitioner holds himself out as a specialist, there is a higher degree of skill required. Jurisdictions have also been increasingly receptive to claims based on informed consent raised by patients who allege that they were not adequately informed of the risks of the medical procedures before agreeing to the treatment. Now, as law varies by jurisdiction, the specific professionals who may be targeted by a medical malpractice action will vary depending upon where the action is filed. Among professionals that may be potentially liable under medical malpractice laws, and that could be either physicians, surgeons, psychiatrists, dentists. We have a dentist amongst us, nurses, midwives, nurse practitioners, physician assistants, allied health professionals, including physiotherapists, osteopaths, chiropractors, podiatrists, occupational therapists, social workers. It could range from psychologists, pharmacists, optometrists, and medical radiation practitioners, basically everybody. So, among the acts or omissions that may potentially support a medical malpractice claim are the failure to diagnose properly a disease or medical condition and the failure to provide appropriate treatment for such medical condition. And there has to be an unreasonable delay in treating a diagnosed medical condition, and that would also result into medical malpractice. In some jurisdictions, a medical malpractice action may be allowed even where a patient was not informed of possible consequences of a course of treatment, and it would have declined the medical treatment had he been, properly informed about it in advance. Now, one of the most significant cases that I read as a law student regarding medical negligence was Messrs. Spring Meadows Hospital versus Harjot Aluwali. I think we all cite this over and over again, wherein there was a complaint petition which was filed by a minor through his parents before the commission, alleging that the minor was being treated in the nursing home in Noida. There was no improvement in the health of the minor, and this went on for a few days, and ultimately the hospital made a senior physician, a consultant pediatrician, to basically consult on this case. And he was admitted as an inpatient, and then the doctor made the diagnosis that the patient was suffering from typhoid, and then the treatment was basically completely messed up, and then he was treated for typhoid, but there was a vaccine that was given which was actually not supposed to be given, and he collapsed, and ultimately basically he was in a vegetative state, and he had to suffer throughout his life, because he had absolutely no way of getting healed, and there was irreparable damage to his brain, and he stayed in AIMS for a long time, and then he had like piled up medical bills, and there was no improvement in his condition. So, in some cases, principle of res ipsa loquitur is applied, but however, in some cases, the doctor can also be vicariously liable for acts of another. So, in this basically in this case, the junior doctor was also liable. However, the senior pediatrician who came on later was also liable. So, persons who offer medical advice and treatment implicitly state and undertake to have the skill and knowledge. So, therefore, they have to have that knowledge that they cannot merely just take care of a take care of a patient without reasonable doubt. They can't just uh, give any sort of a treatment without actually making sure that this treatment would work or not. Now, there has to be an implied undertaking which the medical professional needs to inform the patient of. It is for the medical practitioner to ensure that proper standard of care is followed, and to ensure the care of the patient. There is obviously no human being is perfect, and even the most renowned specialists can make a mistake, and they cannot detect properly or diagnose properly. But a doctor can be held liable for the negligence only if you can prove that he or she is not guilty of a failure, and no doctor with ordinary skills would be guilty of the same sort of care. Now, an error of judgment constitutes negligence only if a reasonably competent professional with the standard skills that the defendant professes to have, and they have to act with ordinary care and not make the same error. So, I think the time is limited, and there are many speakers, so I'm going to leave it here. But I hope you guys learned something.
Thanks a lot, ma'am, for your valuable speech. Now I will move to Mr. Viswajit. Viswajit, are you there? Yes.
I am, sir.
So,
Yes.
yes. So now it is your turn, Viswajit, sir. Over to
Thank you
you.
very much. Thank you very much, Professor Singh. And in more than one way, I have to reflect on what Dr. Gautam said, and I have to say that it'll be a tough act for me to carry on with such sheer brilliance that she brings, and I'm sure as Dr. Pratap as well will bring. So I'll try to be a decent or half decent middle act before the amazing starting that Dr. Gautam's made, and I'm sure the amazing conclusion that Dr. Pratap will present. I'll try to be as brief as possible because I think Dr. Gautam and Maya had very beautifully covered all the aspects of it very, very eloquently, and I will not go into the nitty gritty. So as she was speaking, I was going through my notes and just saying, okay, done, done, done. So I have some other things that I will very, very briefly reflect on. And when I use the word reflect, I do mean only reflect, because I think what I really want my talk to accomplish is for everybody to be thinking about where is it that we are talking about medical negligence, and what ways can we improve the practice as well as the understanding of it. So in addition to what Dr. Gautam said in terms of the technicalities involved, including the owing of duty of care, the standard of duty of care, the breach of that duty, and indeed the damage that it causes. I think there are some other very significant things about medical negligence that one must, almost take a step back and then talk about. So the first one is that this is one of those fields that really brings in a number of very, very interesting and sometimes problematic areas, including, for instance, ethics, right? There are legal ethics, there are medical ethics at play, and then the other areas include and it's always very, very passionate debate, because what we are talking about in many of these cases are lives at stake. So this is a very crucial topic in not just the technical sense and the understanding of it, and not just because it's one of the leading areas of practice as we speak. It's just emerging as one of the leading areas. It's also one of those areas where ethics, morality, duty of care, the ideas that we share as a society, and most importantly, the values that we put on medical professionals come into play. So, in those ways, it is one of the most important, if not controversial, topics. And some of the salient features, which I'm quoting from the old case of Punjab versus Shivram, where and this is something that we keep hearing again and again and again whenever we talk about medical malpractices or indeed medical negligence, that it must always be kept in mind that a doctor is a noble profession and aim must be to serve humanity. Otherwise, the dignified profession will lose its true value. We see that this put a special focus on the dignity of the profession, on the special, almost onerous nature that we assign to our medical practitioners. But that leads to at least two things that we must think of in ways that are clear and coherent. The first one is that whenever we are talking about medical practitioners, and I'll start with the practical problem and then go on to the theoretical problems. The first one is that when we are talking about medical professionals, one of the things that we really miss out is the huge number of people who have access to what can, in many ways, be described as a quack. I'm sure all of us have experienced in rural India. People would claim to be medical experts, and some of them would also put themselves as being doctors, but really they lack that sort of knowledge or indeed training. And we see that that is one of the areas that really needs to be looked into whenever we are talking about the law. The second thing that is also very interesting and also somewhat controversial when we're looking at medical negligence is what standard of care do we assign to the doctors and to the medical practitioners. And I think one of the things which presumably psychologists or others might be in a better situation and better equipped to help us with is, for instance, during COVID, and we've seen that very recently, how some of the doctors, I personally know doctors who were working on shifts that sometimes would last more than 30 hours. Can we then expect the same doctor to apply the same degree of diligence and the same degree of carefulness when she is dealing with somebody who is not as well, who has, lesser work than that particular person? So the standard of care, when we are talking about, I think that is very, very important, that we keep on saying that it has to be a reasonable standard of care. But whose reason is it that we are talking about? That becomes absolutely imperative. The three duties primarily include the duty of care to decide if some medical treatment needs to be done. The second duty includes how to do it, and the third duty, which is where complications arise, which again brings me back to the huge disparity that we see across the world. In fact, it's not a problem that's only Indian in its nature, but this is something that we see across the world, and that really is the post-medical procedure care. Because to pin the causation down is deeply problematic, but it's also sometimes impossible to attribute blame to the medical professionals as opposed to the lack of care post the medical procedure. The last point, which I think again needs emphasis, and as I said, I'll hope to leave you with more questions than answers. And one of the things that we also need to look at is the role of gender if we are to look at medical negligence. For instance, in the UK, there were many cases where, and these cases, many of them were successful, where literally, metal mesh had been inserted into a number of female patients. And it turned out that that was completely the wrong and the inhumane thing to do. It destroyed people's lives. It caused unbearable pain for a number of decades. And finally, people were able to get some sort of reprieve. So I think one of the things that we again need to keep our minds open to and be very, very receptive to is whether the law of medical negligence can be considered to be gendered, if there is that sort of underlying idea there. But I think theoretically speaking, it can't be one of those laws which is very, very straightforward ever, because there are just so many things at play, including human emotions, human passions, the emergency of the situations, and other things. And to always be at the guard is something that is expecting a lot. So to look at the gendered aspect of medical negligence, and also to look at what is it that we can consider reasonable, especially in light of the pandemic that we have gone through and in fact continue to go through. And those are some of the thoughts that I wanted to leave you with. With that, I pass it back to Dr. Singh.
Yes, sir. Thanks a lot, sir. You have elaborated about the COVIDs and all the situations. It is really very impressive one, sir. Now we will go to the topmost advocate of the Supreme Court, Mr. S. Naganan, sir, who just joined right now. So, a very good afternoon to you, sir. Naganan, sir, I am audible to you. Hello.
Yes, you're audible, loud and
Yes,
clear.
yes, sir. So, sir, already the specification was given already in the starting. So, sir, right now we are handing this session to you on this particular topic, sir. Over to you, sir.
Okay. Thank you. Good evening to all of you, to Dr. Rajesh Singh, my co-panelists on this interesting journey on the law of torts. I'm sorry I was held up in court. My matter just got over, so I had to join a bit late. So I didn't have the benefit of hearing the erudite speakers who preceded me, to be educated by them. But I've done a little bit of homework, and let me see how it goes. I think, Dr. Singh, we have to conclude by about 15 minutes I can take.
20 minutes chalega, sir. 20 minutes you can take, sir.
Okay, right.
Okay, sir.
Good. Okay. So I tried to analyze and think as to what is it that I'm going to talk about on this subject, on medical negligence. So I broadly put down some headings. First is, what does it mean? Secondly, what are the essentials of negligence in the law of tort? And those of us who have studied some of it will easily pick up some of these ideas. One is a standard of care. The second one is duty of care. And the third one is res ipsa loquitur. All these are things, which we have easily learnt and heard. So what do these things mean? I'll try to deal with them in the next 15-20 minutes. Then you have what are the remedies in the case of medical negligence? Because under the old traditional law of torts, you had to go to a civil court and establish your remedy. Now you have new legislations like the Consumer Protection Act. Plus, of course, you always have the traditional remedy of the penal code if it is negligence which is culpable. Now, what is it that a victim can get from out of it? He or she can get some compensation. They can get some compensation for past treatment, current treatment, and future treatment also. It's a very recent judgment of the Supreme Court which deals with that. And looking at it from a different perspective, if I was appearing for a doctor, and I do appear for a number of doctors and hospitals in these type of matters, what are the defenses that are open to them? What kind of defense can you expect if you are appearing for a claimant? What is the liability of the hospitals? Is a hospital liable? Is only the doctor liable? Are both liable? Or is only one of them liable? And what about liability of individuals? A person who works in a hospital, can he or she be additionally liable than the hospital? The last and the most important aspect of all this thing is the state of evidence. What kind of evidence can you give? And how do you establish that there was negligence? Because what happens between the patient and the doctor is documented only by the doctor or the hospital. And it doesn't happen in open. So there is no eyewitness to the whole thing. So whom can you call? What can an expert witness give evidence about? And to what extent will consumer courts be able to appreciate expert evidence? Will cross-examination be allowed? None of, or many of these things have come up for consideration in litigation that is, come up before the courts. Now, negligence is non-feasance and not malfeasance. Malfeasance is a different connotation. So negligence is some borderline it is. You are supposed to do something a professional, he didn't do. You are supposed to finish the suturing and pull out the needle, but he forgot the needle inside the stomach. That means you are supposed to do something and he didn't do that. Now, a little ahead if you go, it is the omission to do what law requires you to do in a particular manner. I remember many years ago, I did a case relating to aviation accident on negligence. There was a protocol which the pilot had to follow while landing. And it was shown that the pilot just forgot to lower down the wheels of the aircraft. But fortunately, nothing happened to anybody. And the case got dismissed after holding that there was negligence, but no loss occasion to anybody because our client just got out of the aircraft. He had some back slight problem for a few days. And God's grace, he lived for another 50 years after that. So the thing is, you are supposed to do something. If you don't do it according to law or what you are required to do, then there is negligence. Now, for this, you have to look at what does the medical, fraternity think. Now, often we hear the criticism that when you go to a doctor with a small stomachache, he'll say, do an endoscopy, do a CT scan. And if you've just fallen down, you got a slight headache, he'll say, go through a CT scan. I want to do this, that, 1 million tests will be prescribed, and you're going to be spending some few thousands of rupees to do all those tests. And they say, sir, everything is clear. You're fit as a fiddle. Go and enjoy your life. I said, to do that, why did you expose me to all these things? The answer is, if you look at it from his point of view, if he doesn't do this, then we are in this problem. The peers require you to do this, and you don't do it. And therefore, if something goes wrong, then you are in trouble. Now, what is it? Does the law prescribe that you should do something? If the medical council and its successive avatars, they have prescribed some things as what is the state of ethics that you should follow, things like that. So you can broadly define it as improper or unskilled treatment. That's what you can say. It could be by a nurse, a physician, surgeon, pharmacist, medical practitioner, and hospitals. There's a very old judgment in Bolam versus Prime Hospitals, where the test that this is an English case, 1957, One Weekly Law Reporter 582, in which they applied a test of what is the normal skill that an expert is required to have when he or she is doing a procedure. If that normal skill is not exhibited by him or her, then there is a case of negligence. Now, if there is medical negligence, then it is called a medical malpractice. Now, by the in America, they call it malpractice. Here, generally, the expression used is negligence. So, what happens is the victim suffers some injury. When the victim suffers some injury, what are the remedies that are available to him? Now, there are cases, where the patient was to be given some injection. Now, without doing enough checks, an injection was administered to him at a dose which was not required, and the patient went into cardiac arrest. Now, who is liable for this? Is it a doctor? Is it a nurse? Is it the person who prescribed it? These are issues which have come up in number of judgments. 1988, 4 Supreme Court cases, 39 is one judgment. Like that, the number of cases, I won't be repeating all the cases. Now, what is essential ingredients of a medical negligence? First, duty of care, to exercise proper care. Second, failure to inform the patient of the risks involved. You are required to tell the patient. Many times, we hear that a person went with chest pain, the doctors checked him or her in the hospital and said, no, we can't take any chance. I'm going to wheel you directly into the hospital, into the ICU for care, and I'm going to operate you on now. Come on, give the consent here and now. Many times I get calls, middle of the night from some friend or some associate, somebody relative. Sir, this is what the doctor is saying. What should I do? Now, you see, that means you are supposed to explain the risks. At the same time, you must give the information in such a way that it does not alarm the person, then as a result of this action or inaction, the patient should suffer some injury or loss. The example I was giving you, there was downright negligence, but nobody was injured, so you can't get any compensation. Of course, people claim, I'm doing a particular case where somebody claimed 30 crores for negligence in a tort action on the ground that there was some electrical installation which was not properly verified and done. There was an electrical leakage. That was a case they made out. Of course, the courts didn't believe it. They're in appeal now. But the thing is that, they could go to any extent. And that is what is the issue. What is the injury that has been caused? Now, this breach of duty should be sufficient to call it an actionable claim. You see, if it's not an actionable claim, supposing you are supposed to do some bandage in a particular way causing less pain, but they use something else and it caused you a lot of pain, merely by that, it's not actionable. So the doctor has an important role. What is the role that he has to play? He has to decide what to do. He has to advise. He has to give the line of treatment. He has to supervise the treatment. And he has to see that all that is done. Now, if you don't do any of these things, then the Supreme Court has said in a number of cases, Batra Hospital case and others, where standard of care not met, then you are liable. Now, this expression, standard of care, is a state of the art, which is used in many, many jurisdictions. What does this mean? It simply means that in the state of affairs of the medical world and the state of knowledge that it has, he or she, the doctor, must use that level of care that is contemporarily used. Now, you see, in the past, they used to give an anesthesia with a big contraption on your face, and that smell would be inside you for about 1 week or 10 days. You will always be having the same thing. Today, you don't hear of any of those things. Major surgeries are done now by epidural, and some of them with local anesthesia. So things have changed. So if you don't keep abreast, then it is a case of not knowing what is the state of affairs. Now, what is this duty of care? Now, duty of care simply means that the doctor and the hospital is required to give that much treatment and advice which a person of normal skill would do. Now, if you go to a doctor who studied LMP, there used to be a whole licentiate medical practitioner, it was called. It was not a degree. It was a diploma. And many of them were very good doctors. But just after school, they could go through a 2-year course and they would be given a license to practice. Now, his or her knowledge, it all depends. If you want to keep updated, you will. But if you don't do yourself that favor, then you are in trouble. I talked about res ipsa loquitur. Now, I gave one example, you don't have to argue much about it. There are cases, when a person went for surgery for his right leg, they amputated the left leg. Now, this is something, nothing more is to be argued in this case. The thing speaks for itself. Another thing is, sometimes we get a patient goes for appendicitis and he goes in for a heart surgery. Okay, these are cases of, gross negligence. There can be no, doubt about it. A wrong part of the patient gets operated, Then, like this, there are a number of cases which have come, and a patient went for malaria for some treatment, and they treated her for some other, ailment. They didn't treat her for malaria at all. So these are cases of res ipsa loquitur. Now I go to this Medical Negligence Consumer Protection Act. The 1986 Act brought about something. It put in, it coined a new expression called deficiency of service. Now, what is this deficiency of service has been defined there. And there are a number of cases that have come. Now, one interesting case that has come is quite a recent decision. Suppose you go to a free hospital. There are many charitable institutions which run free hospitals which don't charge anything to the patient. They give free treatment, they give free medicines, they don't charge you for the food. In such a case, if you go and get treatment, and if you have a cause of action against that hospital, would it amount to deficiency of service? And the Supreme Court has said in Nivedita Singh's case that it is not so, because it is free of charge, and this action does not come within the purview of the Consumer Protection Act. But of course, the normal law of torts by filing a civil suit will arise, because even if you didn't charge, the doctor had a duty of care to ensure that this is done. Now, there are a number of cases which have come up under the Consumer Protection Act. Now, what is a service for the purpose of Consumer Protection Act? Is medical service is also a service. Then, whom will it apply to? And another aspect is these doctors, some of the doctors, they work in a hospital. They also have their own practice. Now, in such a case, it becomes quite a task to bifurcate the liability of these two institutions. Because if you went to a hospital, the doctor treated you, and after you got discharged, you go back to the doctor, and he is now not in the hospital, he's practicing, he's permitted to practice, and he does. Then what happens? Now, another issue that comes up is so far as the penal code is concerned, there are a number of cases which have come up before the court also. Section 304A is the most common one. That is, if you do something rash and negligent which causes the death of another person, then Section 304 IPC comes into operation. And to that extent, of course, the standard of proof, as we all know in criminal law, is beyond all reasonable doubt. And so far as other things are concerned, its balance of probabilities also is possible. Then Section 337 IPC also talks of endangering human safety, which also entails a punishment. And 338 is also more or less on the same lines. What is the remedy available to a person who has unfortunately been subjected to this problem? First is you can go to the medical council and you can complain against the doctor to say that the doctor is not discharging his duties properly, is negligent. There is a procedure that they will follow. You can go to a consumer court under the Consumer Protection Act. Depending on the quantum of your claim, you go to the district forum, the state commission, or the national commission. Then you can go and file a civil suit before a civil court. Now, if you want to allege gross negligence of a medical practitioner, there must be some element of documentation that you require. In fact, this has also come up. What extent of documentation is a patient entitled to get from the hospital? Is he entitled to the entire medical record, or is he entitled to only a kind of a discharge summary that is given? These have also come up for consideration. Now we go to compensation. What is the meaning of compensation is that if you suffer a loss, somebody must make it good. And in the 19th century also, these decisions have come up. One of the famous cases is the Livingstone versus Rayward's coal. That means the loss should be paid or recompensed in such a way that you put back yourself in the same position that you could be. Supposing you had undergone a surgery and they blotched it up. Now you have to do another surgery to correct it. And hopefully you will get completely recovered. So all of that must be done. But what happens in the case the person unfortunately dies? You can't obviously put him back in the same position. There's no way you can do it. So the only thing that you can do is somehow fix a monetary amount, which would be some kind of a relief for the person or the family of the person who has suffered it. And recently also this question has come up. Many times in orthopedic cases, it happens that you replace a bone, you put a rod inside. Some 5 years later, you have to do another procedure for that. And what happens with those costs? Things like that. Sometimes you have to do a skin graft. No, those are all cases where courts have now decided that they will take note of future treatment also. And many of them now give a rider to say that in future also you can be compensated. What is the defense that a doctor can take? The defense that most probably we take is that we have taken all efforts, all the state of art care has been taken. And if at all there is something wrong that has happened in the medical condition in which the patient was, this was the best thing that I could do. And that was my medical judgment. So if my medical judgment is that he must undergo a bypass surgery, and unfortunately for him, because of some other complication, the patient collapses, he says, on the available data, what I decided was the right thing. So if at all there's an error, it's an error in judgment and not a negligence case. Now, an error in judgment and negligence is a very thin line that you're going to draw. It is often very difficult to actually pinpoint what the negligence is. Now, there are some other sections of the Penal Code, section 80, 81, 88. I'm not going to deal with them because very rarely those are used. Now you come to liability of the hospitals. Now, is it the hospital that is liable? Is the hospital vicariously liable for what its employees, the doctors, did it? Or is only the doctor liable? these issues have also been decided, and courts have taken the view that malpractice by a doctor working in a hospital, the hospital is vicariously liable. Now, this is only in cases where payment is made. Now, when the hospital is liable, is the doctor also liable? Now, there are a group of 5 doctors. One of them is very famous, and he is the one who oversees the surgery. The rest of the doctors who are working with him, his consultants, junior consultants, and interns and residents, all of them, they're all there. Whom are you going to hold responsible? Is it only the doctor who actually cuts? See, many of these surgeries are long surgeries, especially neurosurgeries. It may last 8 hours, 10 hours, 12 hours. The patient is under anesthesia. So there is a anesthetist that is available. There are other people are available. Nursing experts are available. And there is intensivists that are available if the patient's condition is not good. So all these things have to be seen, So there is a line of distinction. Unless there is direct evidence, it becomes difficult to actually prove as to who is really responsible. I now come to a very important aspect as to how do you give evidence in the case. Now, the consumer courts are supposed to be summary courts, but now over a period of time, the Supreme Court has said that, on the question of expert evidence, it is how do you get expert evidence? Now, expert evidence means supposing I am appearing for a doctor or a hospital, which takes a stand that whatever I did was the right thing to do. So I want to prove it. I produce my medical record. Then I want to examine a witness, an independent outside expert, another heart surgeon, if this is the case of heart surgery. And I want him or her to come and give evidence before the court after looking at the record to say that, this is what is expected of him. This is what the medical science requires. And they have followed it. Then to what extent will that evidence be acceptable by the court? And if in many cases cross-examination is not allowed, but now cross-examination of expert witnesses are being allowed. So what is the extent of appreciation of evidence that you can expect from a lay tribunal, which has either a district judge or a high court judge or even a Supreme Court judge, former judge sitting there and adjudicating these cases to decide whether this is medical negligence and to what extent which doctor's view is correct, and how do these poor patients match up to the capacity of these hospitals which are able to afford best legal advice and good expert evidence, becomes very difficult case for the claimants. There are some landmark cases, I'll just refer to them. Jacob Matthews case, 2005, where difficult choices have to be made by doctors. The Supreme Court noticed that, the higher the risk a patient has got, there are a number of, comorbidities that are there. Number of other complications are there. Somebody who's highly diabetic, his or her blood sugar is not under control. His blood pressure is not under control. He's gone into cardiac arrest, or at least there are 4 blocks in the heart. What do you expect the doctor to do? He's not a god to say, I'm going to cure you and you're going to come out hale and hearty. He only says this is a plus, this is a minus. So the decision making there is a very important case. And so courts have recognized this principle that higher the risk of the patient, higher is the chance of failure. So you can't just rule out and say merely because the patient died, this is a case of negligence. Now, what about 302? Can 302 be invoked IPC? Is it a case where some medication was prescribed which was wholly wrong? Supposing the doctor wrote it in such a way that the spelling was wrongly indicated and they gave the wrong medicine, which ultimately caused the death. Would it amount to a case of murder? There's also a question has come up. The courts have said, no, it won't be so. Then there are also cases where somebody goes through either an Ayurvedic or a homeopathic medicine or somewhere else they go. Then the situation becomes very critical. And then they say, no, we now have to go to an allopathic hospital. And the time lag which they lost there is critical for them. And so the doctor here says, look here, you come late. What can I do? I will still try. And he still tries. And unfortunately, if he fails, what happens? Is another question that is arisen. Now, this is very common in America and other countries also about long-term effects of neurosurgery. Now, neurosurgery is the most complicated surgery because even today, the doctors do not know and they don't figure out what is inside the brain. When they do a neurosurgery, If there is some fluid or some blood leakage or some vessel damage around the brain, they can attend to it. But other than that, they can't actually touch the brain and do anything with the connections. So in a case like this, supposing the anesthetist was negligent, there was some problem, he could not monitor it, or the patient goes into some other trauma at the time of surgery. Now, what are these? To what extent will you apportion blame is also a matter which has come up. Number of decisions have come before the court. So I think to sum up, I would say that uh, the difficulty in fighting a medical negligence case is the difficulty to establish, really speaking, that the doctor was grossly negligent. But the rider that I would like to put is that there are cases when it is very obvious and very apparent. And in those cases, it is possible for us to go and establish that this is a case of negligence, and that requires some relief and remedy at the hands of the court, whether it be the consumer court or a civil court or criminal court, as the case may be. Thank you. Thank you very much.
Thank you, sir. It was very fantastic one, and you have elaborated in a very simplest way. We all can understand the easy language you have dealt, and you have stated the practical assumption, like we have seen in the COVID situation, and how the doctors are liable for this negligence and this all. Now I am moving to another speaker, Mr. Dr. Prashant Pratap. So, Prashant ji, over to you, sir.
Thank you, Rajesh, sir. It was an amazing experience listening to everybody. Dr. Gautam, Dr. Mr. Chaudhary were able to tell us about the basics of the thing. And naturally, Naganand, sir, he has more experience than all three of us combined in this situation. So it was amazing to listen to him and his personal experience with cases. That was very informative for me also. So brevity is indeed my enemy today because we don't have that much time, and it is a big topic to discuss. But I would want to spend the next 15-20 minutes, whatever I've been allotted, in basically juxtaposing clinical and the legal aspects. So I want to discuss what are the most common types of medical negligence cases that occur in India, uh, in the world also, but specifically in India. So we will go on with that. The first of one of the first and most common causes of the occurrence of a medical negligence case is that when a doctor intends to misdiagnose a particular disease, like Naganand sir just said that there was a case of malaria. The patient was suffering from malaria, and he was given treatment for something else. We have that case. I have it at hand also. It was a case of V. Kishan Rao versus Nickel Super Specialty Hospital in 2010. So what happens is the patient goes to the hospital. He's admitted in the hospital for fever and chills, which are basically very common symptoms. Uh, these are the common symptoms between typhoid patients and also malaria patients. So in this situation, the doctor misdiagnosed it as typhoid instead of malaria, and he started the treatment protocol for typhoid. There was absolutely no, the patient was not responding to the treatment, and he was moved to another hospital where the doctors there, they actually did the right thing. They carried out both the tests for malaria, which is a smear test, and also a Vidal test for typhoid. Now, the typhoid test came negative, and the malaria parasite test came positive. So this is where the district forum in this case held the doctor negligent for this particular matter, while the state commission and the national commission reversed the judgment. They did not hold the doctor negligent at all. Supreme Court, on the other hand, they reversed the judgment. Supreme Court reversed the judgment, and went with the district forum's findings and held the doctor negligent for giving the wrong treatment, because the doctor should have did the differential diagnosis between both the diseases, which they missed. The second and other most common issue is delayed diagnosis. When the doctor does not make the right diagnosis, does not take the right call at the right time, which can in the future end up causing a lot of severe damage, which could have been contained in the initial stages. So there's another case, Manu versus Dr. Akhilesh Kumar. It's a 2015 case. So in this, there was an X-ray was taken of the fractured femur of the patient. But what happened was that there were two fractures, and the doctor did not diagnose it right. There was a fracture in the shaft of the femur as well as the neck of the femur. So he only carried out the treatment for the shaft of uh, the femur bone, the long bone in the legs. So what happened was then the patient was admitted to another hospital where the doctors again correctly diagnosed and that it was a neck fracture also. But because there was a delay in fixing the neck fracture, the neck of the femur bone, the person was, 58% of his leg was permanently disabled, and and there was a shortening of the leg also, so he was unable to go through his normal process, and a total hip replacement surgery was supposed to be carried on. So the national commission in this actually held the surgeon negligent, that he delayed the diagnosis and he could not see the diagnosis that the neck was also affected in this particular case. 10 lakh rupee compensation was awarded in this particular matter. There are other issues. The Batra hospital case, as Naganan said, it's very common case, and this is where there was a complication that arrived in the surgery. The person was undergoing a surgery for a tumor, an abdominal tumor, but while performing the surgery, naturally the pancreas was damaged. It's an internal organ in the body. It was damaged, and because of that, there was fluid formation started happening inside. So to drain this fluid out, they put a channel to drain the fluid out, because this fluid tends to be infected and it can infect the whole area. But in this case, the patient went through what is called a pyogenic meningitis, which is actually basically the bacteria the infected part actually traveled all the way to the meninges inside the brain of the patient, uh, and this ultimately resulted in the bacterial infection in the brain, and patient died in this case. In this case, although the National Commission took a different opinion, and based on the medical literature and the evidence of the experts that were there, it held that the hospital, or neither the hospital nor the surgeon was responsible for this. It was not a case of medical negligence, because this can happen in a surgery like this, in a complicated surgery like this. Now, one of the most common blood transfusion cases, the fourth is the blood transfusion cases. These have become rarer in the current scenario, but in the 90s and the 80s, in the 80s actually a lot, and in the 90s also, there were a lot of these blood transfusion cases that were coming. So what happens was, there's this specific case is in Shifali Bhargav versus Indraprastha Apollo Hospital. In this, what happened was the patient was admitted in the hospital with low platelet levels. The patient had 35,000 platelet levels, and the doctors, in a hurry, they, instead of following the protocol, which dictates that only when the platelets drop below 20,000 or 10,000, they should be in transfusing blood. So that is the first mistake they did, was that they went ahead with transfusing the blood in only at 35,000 levels, when it should have been done ideally around 10,000, where internal bleeding starts, to avoid internal bleeding. What the second mistake they did was that they took blood from platelets from 5 different donors without carrying out. There's a battery of tests that have to be done, namely hepatitis B, hepatitis C, and HIV. Whenever blood has to be transfused, the blood samples, the donor has to be tested for these things. So there are no transfusion transmitted infections. But they negligently did not carry on the tests, and later the patient developed hepatitis C because of the wrong transfusion, and because of this transfusion transmitted infection. The National Commission, again in this, held the doctor and the hospital negligent, that they should have carried the protocol that was necessary for this. So anesthesia cases are also there, very common cases, very common occurrences in most surgical settings. There was a case of Dr. Vijaya Nirmala and Udit Kumari. So in this case, the patient was admitted for a removal of gallbladder stones, and but during the procedure, the patient expired. So the cause of when they did the post-mortem, they found higher levels of excessive dosage of sodium thiopentol, which is basically a barbiturate-derived general anesthetic used in surgery. But the expert opinion in this particular matter opined, the expert opined that the levels were within the normal range, normal limit that is considered to be normal, and it should not be the cause of the death. So the cause of the death is something else, and the anesthetic was not held negligent in this particular matter also by the National Commission. There's another sir also has mentioned that the quacks and the people who don't have the knowledge and they are also practicing. So what happens, that which is a common occurrence, sir has also mentioned about RMPs and LMPs, registered medical practitioners. This thing was started I think in the 70s or 80s when we had a shortage of doctors in our country, and there were a lot of patients. So this program was started, the RMP program, that these registered medical practitioners can actually give medicines and do basic treatment of the patients without having a proper medical education. So in this case, there's another case, AM Mullah versus Nonawada. This is a Karnataka case only, Karnataka State Commission case only. So in this, what happened was there was a 10-year-old patient, and he was he went to the doctor for treatment of fever. Now the doctor prescribed him Septron, which is basically an antibiotic, to trimethoprim, sulfamethoxazole. He gave this child. He should not have given this child this particular medicine. He gave it to him, and the patient developed severe adverse reactions, and he lost his eyesight. A 10-year-old child, he lost his eyesight in this. It was later found that the doctor was actually a licensed homeopath. He was a homeopathic doctor. He was not a MBBS doctor, and he's not supposed to be prescribing these medicines because he has no knowledge about the pharmacopoeia related to allopathic medicines. Again, the state commission held doctor negligent in this because he was negligent for prescribing the allopathic medicines of which he has no knowledge about, or he was not even trained into. Then we have overdose cases. Naturally, they are very common. There are many cases are there. Largely, in many medicines, it is found that you're supposed to give doses has to be calculated by measuring the body weight of the individual, the age, the gender of the individual. So in one particular case, Madhusudan versus Dr. Suresh Gupta, the 2.5-year-old child was given ketamine. Again, that's not a medicine that should be given to a kid because it's an anesthetic. And what happened was the dosage was not adjusted properly by the doctor in this particular case. And the child went into anesthesia, and then he could never regain consciousness. And 3 days later, he died. So again, the commission held that the doctor was negligent because these are basic protocols, these are basic things that have to be followed by every doctor. Now, I would be wrapping it up soon because this is going to go for a very long time. The one of the more common things that we have personally witnessed, we have noticed in the newspapers, this kind of stories keep on coming. Leaving a foreign object inside during the surgery. This has happened. This is one of those preventable medical errors, and in this, basically, these fall under the category of retained surgical instruments, where surgical instruments like artery forceps, surgical scissors, scalpels, clamps, or gauges and sponges are negligently left inside the organs of the individuals while performing the surgery by doctors. So this is absolute gross negligence. This should never happen because this is very dangerous. Surgical instruments are sharp, and what happens is most of these end up perforating the internal viscera of the individuals and cause massive internal bleeding and death. So this is also very a practice that is very looked very badly by the medical council, as well as the whole. So it's considered to be a very, very blatant disregard of the procedures that have to be followed. Uh, Septicemia can also happen. Severe infection can happen, and most patients, when it is not detected in time and the treatment is not carried out, results in blood poisoning. There must be about 100 cases on this particular thing, and it's very common occurrence happening around our country. This is definitely not an exhaustive list. There are a lot of other things, but there's the 10th point that I want to discuss are the long-term negligent treatments by doctors. See, there are medicines that are supposed to be only given for a limited period of time, like a week, 2 weeks, couple of weeks, 4 weeks maximum. But doctors end up prolonging this medication protocol beyond its established by clinical trials. And there is another medicine. This is something that is occurring very recently. There's a medicine called levosulpiride that doctors are using in combination with acid blockers for treatment of acidity in patients, also used in psychiatric patients, this particular medicine. So this medicine has been seen that prolonged use of this particular medicine causes extrapyramidal effects and can actually cause Parkinson's, the disease, with tremors and everything. So this is one of those negligent practices that are happening. This is one of the examples I'm citing. And there's case law on this, not under our jurisdiction, but in US, there's case law that certain medicines like these should not be prolonged for a very long time. I think I will end my segment at that, and back to you, Dr. Rajesh, sir.
Yes, Prashant, it was very fantastic session. So we
Thank
have certain questions right now which a student has sent to me. This question is to Mr. Naganan sir. I am audible to you, sir.
Yes.
Sir, the question is that, sir, in the pandemic situation, there is a lots of scarcity of the remdesivir medicines. Now, what is happening that these medicines are provided by the government to the hospital on the demand of the patient admitted in the hospital. Now, sir, in that cases, the patient is not able to get that particular injection, and due to which the scarcity arises as this unavailability of these injections. So, sir, whether it is coming in the negligence or not, if the item is not provided to the hospital, so what hospital can do?
It can't be negligence, you see.
Yeah, sir.
Can't be negligence.
Yes, sir. Yes, sir.
The line of treatment is something
Yes,
which
sir.
the hospital will decide.
Yes, sir.
And then the medication that has to be given will also be something which the hospital prescribes. Now, if that medicine is not available, I remember like this many years ago, there's a patient, there was a medical negligence while delivering the child. They clamped her urethra and forgot to release the thing, and there was a bloating of the urethra. Now, the result of that was that drug has to be administered, and that drug was not available in India. It has to be got from somewhere abroad. So, the hospital is not responsible to get the drug. If it is not available, you can't give. So, the doctor can only tell the patient that, you see, this drug is good for you. If you can get it, we can administer it. But if you don't get it because it's not available, we can't administer it. I'll give you one example. This IMRT is a treatment which they give for cancer. Image guided radiation treatment, it is called. About 20-30 years ago, there was no such facility in India. Now, of course, many cancer hospitals have it. So patients had to go out of India for that purpose. So there are lines of treatment which may not be available here. I know recently, even in a country like Japan, there was a lady who had heart failure, and they advised that she should be taken to Chicago in the United States for a heart transplant, because there is a fastest heart transplant record in the world they have there, because their national heart bank is all linked up, and anywhere in America, if there's heart available, they can able to get it. So that lady went all the way there from Japan to USA. So what I'm saying is, the answer to your question is, non-availability of drug is really not a case of negligence at all. Nothing to do with the doctors.
We have one faculty. I think you have given the answer that only if the patient consent treatment is given, then recovery is not entirely.
Yeah, that's what I give.
The
That's
doctor.
my answer.
Yes, sir. Yes, sir.
Gagnit had answered a question about treating patients
Yeah,
for
sir.
cancer when the
Yes,
doctors know he or she is not going to survive.
Yes, sir.
That's $1 million question here. The doctors will tell the patient that, look here, this is your condition.
Yes.
This is a line of treatment that is available.
Yes, sir. Yes, sir.
If you take it, there is a possibility that you will survive. But if you don't take it, you are surely going to die.
Yes, sir.
So it is ultimately the decision of the patient. If a patient can afford it, they will take the treatment. If they cannot afford it, they'll say, we'll take the patient home and let him or her die. So that's nothing to do with negligence. But the thing is, the role of the doctor in such cases is a very difficult one, because the doctor knows that there is very little chance of survival. But the doctor cannot tell the patient, this treatment is available. I'm not sure if you're going to survive it, so I don't give you the treatment. Doctors can't do that. It is a patient's decision.
Yes, sir. Sir, thank you. Thanks a
Okay.
lot, sir, to
Thank you.
all these questions.
Okay.
And sir, we will put certain questions on your mail because it are 10 to 12 questions from the student. So we
Okay.
will put on your mail, sir. So we will get the answer from that only. So not wasting more time. So we are very much thankful to all the dignitaries and especially from the Parul Institute of Law and the Faculty of Law. So we are very much thankful to giving all the precious time to all the dignitaries.
Thank you very
Thanks
much.
a lot for your kindness, sir.
My
So we are,
greetings to my panelists and all to students. All the very best.
yes, sir, yes, sir,
Work hard. There's
yes, sir, yes,
no
sir, yes, sir,
substitute for hard work and reading.
yes, sir, yes, sir,
I delivered a talk on law and literature. It should be available somewhere in on YouTube also.
yes, sir,
Maybe
yes,
you
sir,
can ask your
yes,
students
sir.
to look at it,
Sure, sir, sure, sure.
because reading is something which widens one's mind. You can't just read law and then go and argue cases. I've given examples of how we have cited from Mahabharata, from Bhagavad Gita, from the Bible, so many other things. So you have to have a wide range of reading. That's very important for students
True,
and
sir.
all.
True, sir. True, sir. So on
Thank
this
you.
note, sir, we are closing. Thank
Thank you.
you, Naganan, sir. Thanks a lot, Viswajit, sir. Thanks a lot, Malika ma'am. And thanks a lot to Gagnit ji, who has continuously asking questions. So on this note, sir, we are closing this session. I am thankful to the Facebook Live to Jitin Kubhani, sir, who has taken all the live coverage. So on this note, I'm closing the session. Thanks
Okay.
a lot, sir. Have a nice day.
Thanks to everyone. Bye.
Thank you.
Thank you, sir. Thank you, sir.